Welcome to the Healthy Body. Dr. Alex here. Today, we're diving into a topic that far too many men suffer from in silence. Penile pain, especially pain at the tip of the penis, and how pelvic floor physical therapy can help relieve it. Now, I know it's not the easiest subject to talk about. Many men feel embarrassed or unsure of who to ask for help. But if this sounds like something you've been dealing with, burning, stabbing, or aching sensations in the penis or pelvis, you are not alone. And there are real, effective solutions. Before we get started, if you're passionate about improving your health, vitality, and overall well-being with science-backed practical tips, go ahead and hit that subscribe button. This way, you'll never miss an episode that could make a real difference in your life. Let's begin by understanding what's actually going on when pain appears at the tip of the penis. In many cases, this type of discomfort isn't caused by a skin issue, infection, or urinary problem at all, but rather by an irritated nerve. The main suspect here is a branch of the pudendal nerve called the dorsal penile branch. This nerve travels along the underside of the penis, ending right at the tip. When healthy, it sends sensation signals without causing discomfort. But if it becomes irritated, overstretched, or compressed, it can create sharp, shooting, or burning pain. In some men, it can even trigger a deep, aching soreness in the pelvis as well. So, how does this nerve get irritated in the first place? Well, nerves don't like being compressed, and they don't like being stretched beyond their comfort zone. When either happens repeatedly or for too long, they send pain signals as a kind of protest. One scenario is overstretching during sustained erections. Normally, erections don't cause nerve problems. But if an erection lasts much longer than normal, perhaps due to certain medications or a condition called priapism, the penile branch of the pudendal nerve can be stretched for hours, leading to irritation. Another common trigger is exercise, especially heavy squats. When you squat, the pudendal nerve glides over a small bone in the pelvis. In some men, this bone is slightly more prominent, and repeated friction from heavy lifting can irritate the nerve over time. And it's not just the gym. Aggressive sexual activity, whether that's vigorous intercourse, intense masturbation, or even overzealous jelqing exercises intended to increase size, can overstretch the nerve and leave it inflamed. Compression is another culprit. The penile branch of the pudendal nerve travels between two key muscles in the pelvic floor. These muscles are essential for sexual function. They help you get and maintain an erection, and they play a role in ejaculation. When these muscles tighten excessively, they can squeeze the nerve, making pain worse, especially during orgasm. When they contract rapidly, this is one reason why some men notice their pain spikes right after ejaculation. Now let's talk about how those pelvic floor muscles get so tight in the first place. Daily straining to urinate or have a bowel movement is one factor. Each time you strain, those muscles contract. Over time, this repetitive pattern can leave them in a chronically tight state. Another cause is overdoing pelvic floor exercises like Kegels. While Kegels are helpful for some men, especially those with weakness or urinary leakage, they can be harmful when the muscles are already tense. Think of it like constantly flexing a cramped muscle. It only makes the discomfort worse. So where does pelvic floor physical therapy come in? A skilled pelvic floor physical therapist can evaluate your specific muscle and nerve function to pinpoint what's causing your pain. They'll ask about your daily activities, past injuries, and any patterns you've noticed. Then they'll perform a physical assessment, not just of the muscles themselves, but of surrounding tissues and nerves, including the pudendal nerve. If they find muscle tension, they can use manual therapy techniques to gently release it. This creates more space for the nerve, reducing compression and irritation. They can also guide you through stretches, breathing exercises, and lifestyle adjustments that protect your pelvic nerves during workouts, intimacy, and daily life. Sometimes they may recommend involving other specialists, like urologists, pain specialists, or even psychologists, to address the full picture of your health. Pelvic pain can be incredibly frustrating and isolating. Some men go years without the right diagnosis, while others are told nothing can be done. But that's simply not true. There are effective, safe treatments that can help restore comfort, function, and confidence. If you've been dealing with this kind of pain, know that there's hope. Find a pelvic floor physical therapist in your area who has experience with men's health issues. The sooner you start, the better your chances of long-term relief. And if you're finding this information helpful, now's a good time for a quick reminder. Hit that subscribe button so you can keep learning about ways to protect and improve your health at every stage of life. Now, I want to give you a few practical tips you can start right now. If you work out, avoid jumping straight into heavy squats without warming up. Pay attention to pelvic discomfort during and after training. During intimacy, listen to your body. If certain positions cause pain, adjust or pause to prevent overstretching the nerve. Stay hydrated and maintain healthy bowel habits to avoid daily straining. And if you've been doing pelvic floor exercises, check with a professional to see if they're actually helping or making things worse. Your pelvic health is just as important as your heart, brain, and muscles. By addressing issues early, you not only reduce pain but also protect your sexual function and quality of life for years to come. If today's topic struck a chord with you, take that as a sign to seek help rather than suffer in silence. Relief is possible, and you deserve it. Thanks for joining me today on The Healthy Body. If you found this valuable, make sure you subscribe so you'll always have access to practical, science-backed strategies for better health and vitality.